Next, please welcome to the stage Associate Professor at Georgetown University's School of Foreign Service, Dr. Shireen Joshi, Population Institute's Director of Research for Sexual and Reproductive Health and Rights, Bridget Kelly, United Nations Senior Advisor to the UN-EU Spotlight Initiative to Eliminate Violence Against Women, Erin Kenney, and the White House Gender Policy Council's Deputy Director and Assistant to the President, Rachel Vogelstein, for a conversation with FP's Vice President of Research, Dr. Maisha Alam, on sexual and reproductive health and gender equity.
Hi, everybody, and good morning. It's wonderful to see such a packed room of passionate and dedicated professionals who are here to discuss common interests. And I'm really, really excited and honored to have the opportunity to moderate this particular panel, which is on connecting the dots between sexual and reproductive health and rights and gender equity, and how are those related, and what does it mean for the economy, for politics, for peace and security. I'm going to forego introductions. As you heard, we have a really, just some technical issues. We'll get going in a second. We're going to have a far-reaching conversation and try to get as many topics covered to connect those dots for all of you. Bear with us. Thank you. All right, we're ready to go. And Bridget, I'd really love to start with you, and if you could help set the scene for our audience and connect the dots here. And so let me ask you this. With the largest generation of youth in history reaching their reproductive years, why is now such an important time to mobilize action and investments on sexual and reproductive health and rights?
Thank you so much, Maisha, for the question, and thank you all for joining me here in this discussion today. I'm beyond honored to be a part of this dialogue with all of you, but also with all of you in the audience, so thank you. Okay, why now? Now is a really opportune time to invest in the lives of women and girls around the world. About this time last year, there were plenty of conversations about the meaning of the world population reaching this 8 billion mark. Now, for me, what that number means, or it signifies, is that the scale of human needs is growing. And we really need to grow our investments to meet the moment. Like you said, we have the largest generation of youth in history, 1.8 billion people between the ages of 10 to 24. That's 1.8 billion people reaching or already at their reproductive capacity. Furthermore, 90% of this generation lives in the global south, and many have obstructed access to sexual and reproductive health and rights. We have to do right by this generation. So as the population grows, so too should funding in sexual and reproductive health and rights. But the US bilateral funding for international family planning and reproductive health, it has remained flat for a decade at $608 million. Now compare that to the fair share estimate that the US should be providing of $1.74 billion. We're far way off, but we have to meet this moment, and we cannot fail to keep pace with the needs and the rights of this generation of youth. So it's going to take a big investment, but it's not just the investment. I mean, of course, it's a really important piece to this, but so too is the increase of political will.
Mm-hmm. Yeah, and I think you've just touched on a number of really important pieces here, and I just want to underscore a couple of them. One is, of course, related to the level of investment and the gaps that persist in terms of that investment. The other is related to political will and leadership and commitment, sustained commitment. And the third is, of course, the role of the United States government, whether through bilateral funding or partnerships. And Rachel, with that, I'd love to actually bring you into the conversation. You are at the White House leading much of the Biden-Harris administration's work around gender equality. And my question for you is, how is the Gender Policy Council trying to address these issues, and how do domestic legal and legislative developments like, Dobbs v. Jackson, how does that shape the way the U.S. supports SRHR globally, including in fragile contexts?
Well, thank you. Can you hear me?
Yeah. Can you bring the mic up?
Can you hear me now?
Yes.
Terrific. Thank you for that great question. Thank you to Foreign Policy for convening this important conversation. It's great to be with all of you today. I'm really appreciative of the opportunity to talk about the Biden-Harris administration's support for sexual and reproductive health and rights globally. Advancing gender equity and equality has really been a priority for this administration since the inception. Back in March of 2021, on International Women's Day, President Biden issued an executive order creating the first ever White House Gender Policy Council. Also, that same executive order mandated the development of our first ever national strategy on gender equity and equality. And that outlines 10 strategic priorities on a range of issues, from economic participation to political participation, addressing gender-based violence. But one of those 10 priorities is focused on protecting, improving, and expanding access to health care, including, importantly, sexual and reproductive health and rights. And we know how critical this work is, not only globally, but right here at home. You mentioned the Dobbs case, and as we know, it's now over a year since the Supreme Court here eliminated a constitutional right that women had really come to rely on for nearly 50 years. Now there's more than 23 million women of reproductive age, 1 in 3, who live in states with harmful bans in effect. And in response, the administration's taken a series of executive actions to protect access to reproductive health care. President Biden has issued 3 executive orders. We stood up a task force on reproductive health and rights. And the administration continues to press for a law that would restore the protections of Roe v. Wade. But that said, even while the administration is working to protect and defend reproductive rights here in the US, we continue our work to advance sexual and reproductive health and rights abroad. And I want to just clarify for everyone that the Supreme Court's decision in Dobbs does not alter the administration's commitment to advancing sexual and reproductive health and rights around the world. Our policies, our programs to advance global health, including SRHR, remain in effect. So the United States continues to be, for example, the leading donor to family planning services worldwide. That's a commitment that spans more than 5 decades now. And Maisha, you asked specifically about US support for SRHR services in fragile contexts. So I want to highlight in particular our partnership with the UN Population Fund, with the UNFPA, which we really turn to as our key partner in some of the most challenging humanitarian situations we face, from Afghanistan to Yemen to Sudan to Ukraine. UNFPA provides reproductive health services, it provides gender-based violence prevention and response services, it provides protection from sexual exploitation and abuse. And so we're proud to be the largest humanitarian donor to UNFPA, and we're also really proud of the administration's commitment on foreign assistance to advance gender equity and equality. Back in the beginning of last year, President Biden made a commitment to double our resources to advance gender equality through our foreign assistance from 1.3 to 2.6 billion. I'm proud to say that we've exceeded that number, and we know there's a lot of work to do, but the administration is standing strong behind these issues.
Thank you for that, Rachel. And again, I think there's so much to unpack there. I appreciate your point about needing to reiterate that the U.S.'s international commitments are steadfast in this area, and that there's a commitment to actually grow that over time. And one of the things you talked about was the importance of partnerships, and in particular, partnering with UN agencies, and especially in hard-to-reach places and communities that are sometimes most at risk or most at need. And that actually serves as a perfect segue, Erin, to bring you into the conversation. And I'd love to hear, from your perspective, if you could talk a little bit about the reinforcing or mutually reinforcing relationship between girls' education and sexual and reproductive health rights. Why do early investments matter? We heard from Bridget earlier talking about, the largest generation of youth in history coming into their reproductive years. We heard from Rachel talking a little bit about how this is a critical piece, but part of a broader set of issues that need to be mobilized in tandem. Can you help connect the dots specifically around girls' education and SRHR?
Absolutely. Thank you so much. Thank you, Foreign Policy, for having us here. I want to give a special shout out to Table 18. You know who you are. I sat with you at breakfast. And I just want to say that conversation completely inspired me. And I'm going to take a lot of what we talked about and bring it in here. We were talking about connecting the dots. We were talking about the importance of big investments that consider the whole person, not just how they experience violence, or not just their family planning needs, but everything in their lives, and how that actually intersects to ensure that they can be healthy and really productive in whatever way they define that. So Spotlight Initiative, if you don't know, it's a UN initiative out of the Secretary General's office that was launched with 500 million euros. Now, I often get like a little gasp when I say that number because it sounds like a lot of money. It is a drop in the bucket for what is needed to actually end violence against women and advance gender equality. And so what we've done with that money is explicitly looked at it as a Sustainable Development Goal accelerator. We look at how we can take the best of what's happening, the best of what everyone's doing, the best of what UNFPA is doing, but then connect that to what others are doing. So for education, very explicitly, we look at SRHR interventions and then connect them to what's happening in formal and informal education systems in order to really have a multiplicative impact on multiple generations that can inform and transform this issue. As a result, Spotlight Initiative has actually enabled 5 million more girls to stay in school. We have transformed gender equitable attitudes for 90 million young people. This is massive,
Please welcome
transformative.
to the stage United Nations Global Compact Assistant Secretary General.
Oh, apologies.
That's
Sorry
all right.
about that, Erin.
That's all right. I think that was it. But thank you so much.
Thanks for bearing with us, everybody. It's a great program, and sometimes we have little hiccups, but women, we keep going. And so with that, I'm actually going to go to Shireen next. And we were just talking behind the scenes. Shireen and I have known each other for what would we say, about 15 years at this point, which is wild to say. And Shireen, you have been working on these issues as a political economist and trying to understand what the data shows and how do we make scalable change, right? So we're talking a lot about the investments that are required, the policy interventions that are required. And one of the really important pieces of this agenda is what it means in terms of when you invest in SRHR, women's economic productivity, their own economic security, and of course, what that means for their communities, for their families, and societies writ large. And so, can you help us understand how does having control over one's own reproductive choices create more economic agency over the course of a woman's life? And of the many studies and reports and research that you have authored, what does the data show? What's most compelling? Can you share some examples?
Yeah, sure. Can you guys hear me? All right, thank you. Thank you, Maisha. Thank you, Foreign Policy. And thank you to all of you for being here. It's a big honor. You're right. About 20 years ago, the academic research on finding causal linkages between greater reproductive control and economic empowerment was actually pretty thin, right? This is an evolving area of research. Really, the past 20 years have given us a plethora of new insights into this. The bottom line, I think, that emerges from this new literature is that having more control over reproductive choices really enables women to invest more in their education, finish higher education, really think it used to be job, now it's career, right? But plan your career, and really, it improves kind of financial trajectory, right? So the idea is more control over the timing of births means more wanted pregnancies, fewer unwanted pregnancies, which basically means more opportunities to invest in not only her own, mom's own human capital, but that of her child as well, right? So it's a win-win in some sense. Greater birth spacings and greater control lead to benefits for the whole family, right? So 2 examples of academic research that are really interesting, right? One is Claudia Golden. She just won the Nobel Prize. I was thrilled. Her work on the pill, right? So she wrote a really important paper that basically demonstrated the rollout of the pill in the 1960s probably benefited a lot of us in this room, no matter where. I didn't grow up in the US, but no matter where in the world you grew up, the rollout of that pill in the 1960s to 1970s had a revolutionary impact on a generation of women, right? Because it enabled them to stay in school longer, enabled them to plan their careers, and a lot of us in this room are benefiting from those changes in society. So that's her work in the United States. My own research comes from Bangladesh, where we looked at a program, again, contraceptives, funded by USAID in the 1970s, right? Exactly at this time, where hard to reach area, very conservative, very poor part of Bangladesh, USAID rolls out the Matlab program in collaboration with the Bangladesh government. Very expensive program. Declines in fertility were about 15%, which was viewed as small, but it wasn't just contraception, it was woman and child health comprehensively. Speaking of, Erin, what you said, the whole person, right? And over time, what I showed in my research was this led to dramatic impacts on women's ability to kind of save more, build more assets, upgrade their housing quality. So I'll leave it at that. Like that's Claudia Golden's work, my work, but there are many studies like this now, and I don't think there's ambiguity any longer. Investments in SRH really pay off.
Yeah, thank you for that. And I appreciate those 2 contrasting examples of the US versus, the largest economy in the world versus what is a lower middle income country economy, and how transformative that impact was. And I have to say, I'm Bangladeshi American, so I have to say this, but what that has meant also in terms of the national economic prosperity is that whether it's GDP per capita, whether that is many of the SDG indicators, Bangladesh, because of those interventions in the 70s related to family planning, now leads in the subcontinent on every indicator, including GDP per capita, right?
Absolutely.
That's really, really important, that when you enable women to have agency over their bodies, the economic effects are not just their own, but national and regional as well. Another thing that you said that I think is so important, and I love the way you put it, Shireen, is distinguishing between a job versus a career, and being able to understand the trajectory of a person's life and a woman's life. And Rachel and Bridget, I'd like to turn to you next and go into something that I think is a tougher area to make progress in, which is politics and the political participation arena. This is an arena across the globe where gender inequality is the widest. We are seeing even now, I believe this week, Iceland, which is often ranked across every year as the most gender equal society in the world. Women are striking again 50 odd years after the revolutionary strikes of the 1970s, saying that inequity persists, even in a society where women have been in political leadership positions for so long. And so my question for you is, can you help us understand, Rachel and Bridget, how does strengthening SRHR relate to women's political participation and women's leadership and decision making when it comes to democracy and governance? What's the connection there?
I'm glad to jump in first, and these issues are integrally related. We observe in our national gender strategy that both of these areas are priorities, but that there are also intersections between them. And we know that women's political leadership is related to policies that advance gender equality and that support critical issues like women's health. So there's a growing body of evidence that confirms that women's leadership promotes policies that advance equality, that when women comprise a critical mass of legislatures, and the social science research suggests that that's about 25 to 30%, that we start to see differences in how decisions are made, and that women are then more likely to challenge established conventions and policy agendas. For example, there's evidence that women are more likely to advocate not only for equality, but for social welfare and to invest in areas like health. And that's not limited to health. We see that women's leadership also promotes stability. And Maisha, no one knows better than you from the great research you've done that women's participation in leadership at peace processes and decision-making tables related to conflict resolution makes it less likely that the response to a crisis will be a violent response. It makes it more likely that peace agreements are forged in the first instance, and more likely that they'll last for at least 15 years. And in an era of recidivism and conflict, which we are seeing today, that's a really important finding. So we have worked to address the dramatic underrepresentation of women in leadership positions across the globe. That was a priority when President Biden announced the first Summit for Democracy. There have been two, there will be a third, another one next year. And an example of our work, I would point to the program that USAID is leading underneath the President's Initiative for Democratic Renewal that's focused on advancing women and girls' civic and political leadership, focused on building the pipeline, but also addressing the scourge of gender-based violence, and in particular online GBV, that is driving women and women's voices from leadership and from public life. So this is a priority, and it is integrally related to the policies that we see, or the lack of support that we see on issues like sexual and reproductive health and rights.
I'd love to bring you in a second, Bridget, but actually, Rachel, something that you said I think is really important, and if you could elaborate just a little bit. One of the things that you mentioned in your comments just now relates to harassment and bullying and all kinds of vitriol that often takes place in the digital space, and what that means in terms of both women being able to go to the polls and vote and cast their vote, but also run for office. What are you seeing in your work related to that, and how are you thinking about that in terms of how to address those challenges going forward?
Well, I will tell you that when we meet with foreign delegations, with women leaders from across the globe, this issue comes up again and again and again. And it's a priority for President Biden and the Vice President Harris, to address this. When President Biden was running for office, he made a campaign promise to create a national task force on gender-based online harassment and abuse. That task force ultimately was convened, produced a blueprint for action on how to address that scourge here in our own country. And then on the global stage, we formed a global partnership for action on gender-based online harassment and abuse that's now grown to 13 countries, multilateral partners. We're working closely with the UN on this issue. And what we're really trying to do is three things. The first is to elevate this issue on the agenda and to make sure that we're addressing it through policy. And we've done that through UN resolutions and through other steps that we've taken. We're working programmatically to support and invest in programs that combat this scourge of gender-based online harassment and abuse. And then we're working on data, because we don't even have a baseline. There are some great studies out there about the proliferation of this issue, but they fail to capture the full scope of what's going on. And so we hope that through this global partnership that we'll continue to pull more nations together to address this issue, but recognize it's also happening here at home. And so that's why we have a national task force and an interagency group working to address it.
Thank you. Thank you for sharing that and for those examples as well. Bridget, turning to you, and from your perspective as somebody who has been steeped in issues of reproductive health and supporting the ability of women to have control over their bodies and to also have access to the care that they need, because this is also about health and rights together. How does that relate to politics and political participation? Are there any particular programs, initiatives, or even just cases that you can highlight that you think are quite kind of illustrative of that connection?
Yeah, thank you. And before I answer that, I just want to really highlight that through this conversation, one theme that keeps coming up that I hear is this mutually reinforcing relationship between gender priorities, such as girls' education and women's economic empowerment and the political involvement, and that relationship with sexual and reproductive health and rights. Increasing women's political participation is imperative to ensuring that sexual and reproductive health and rights and well-being is met around the world. But it's also reinforced by access to sexual and reproductive health and rights. And so we know that when women are in positions of authority, like Rachel has said, that they tend to focus on issues related and impacting women, and not just women, but their families and their communities. For instance, research shows that when more women are occupying positions of authority, the maternal mortality rates decline in that area. And that's because they're having more focused policy discussions on contraceptive access, on prenatal care, on education. But we also know that a woman's ability to participate in these conversations and in these decision-making processes is really dependent on that woman's ability to exercise autonomy over her own body and over her own life. And so many international gender advocates have identified key areas of investments that they're asking us to invest in, and so that they can be participating in these discussions. And those three key investments are meeting the demand for contraception, eliminating gender-based violence and harmful practices, and protecting and fulfilling sexual and reproductive health and rights worldwide.
Thank you so much for that. And actually, that lends to my next question. And I was going to go to Shireen and Erin with this first, but I welcome everybody's input on it, which is we've heard a lot about the connections. I think the goal of this panel was to connect the dots. We have connected those dots, I think, quite robustly. But when we think about where do we go from here, what are the most urgent, actionable priorities? Shireen, if you were to say these are the ones that, from my research, I feel policymakers must prioritize at this juncture, what would they be? And similarly, for you, Erin, from your vantage point at the UN, what do you see as the areas that are either most neglected or that have the most transformative potential?
So what I would say to that is institutional change, really. And I'm going to draw on my work in India for this. I'm working with the Self-Employed Women's Association, SEVA. And really, the kind of institutional change that I'm going to think is badly needed right now is bottom up, top down meeting bottom up, right? Because my work in India, what we're really trying to study is when women form networks, when there's really social solidarity among women, and I'm talking in the slums of India or middle class households in Delhi, either way, it is really working together to identify, is it childcare? Is it health? Is it an expansion of capacity of the local clinic? Is it family planning, doorstep delivery? those priorities vary enormously across communities. But when women come together and deliberate in a meaningful way, right? And there is a system that can listen to that demand. Now that's a really hard thing to do, so I don't want to say it's simple and it's not just about money, right? Like this requires institutional capacity, both at the bottom, but I think change happens when the top and the bottom meet, right? Bottom up meets top down, and that's where the magic of change really happens, and I think that's where we've stalled across the world. The imbalance between top and bottom, I see as being the best possibility we have.
Thank you for that. I love that. I love that's where the magic happens. And what about you, Erin?
I mean, this panel is so well aligned because it's essentially exactly what I was going to say, right? I mean, this is a challenging question because you're asking us to identify those bespoke priorities when everything is needed all at once, right? Everything, everywhere, all at once is what's required. So that's what I would say, is that we need it all. But really, it is that systemic understanding of all of the intersections between violence and bodily autonomy and political participation. In Iceland has one of the highest rates of violence against women and girls, despite the fact that it's always top of the Gender Equality Index. Think about that. Everything, everywhere, all at once. We need to consider the ways in which we are investing in localization, and I'm so glad that this is really part of the US agenda and many other policy agendas to really consider who is making the greatest impact on the ground. But an investment in localization, an investment in women's rights groups on the ground without coupling that with a seat at the table for those same organizations, those same voices in policy change, will just mean that we're feeding a beast that we're not actually changing.
That's right.
We need interventions that really consider every space in which we can have an opportunity to change the status quo. Right now at the UN, there's a debate on women, peace, and security, and a lot of what's happening is this kind of understanding of how we center women's voices in peace and security. And I get really excited by this. I have a humanitarian background, but sometimes I get a little frustrated as well because the narrative has gone from the poor, victimized, vulnerable woman to women at the heart of peacemaking. And it's almost like we've gone too far, right? Yes, women need to be at the table for peacemaking, but without the political participation and incentivization for peace, what voice can women really have? It's a kind of a setup, right? So we really need to consider all the pieces that need to be in place, and it is kind of about money as well. We need deep investments, and it's such a hard time to ask for money. But every investment we make in women is an investment in peace and democracy. It is an investment in sustainable development. There is no excuse.
Thank you for that. And your point about everything, everywhere, all at once reminds me of another saying that we have in this community of work, which is nothing about us without us, right? And so let me conclude this panel. We're almost out of time. I want to get one more question in, and we got to go really quickly. But let me ask you this. We have many women, students and early career professionals joining the summit today, both virtually and here in person. And so from your vantage point and the many years of work that you've done on these issues, what's your call to action for them when it comes to SRHR? I'll start with you, Shireen, and we'll end with Rachel.
I would say demand, be part of, and advocate for institutional change wherever you are, local as well as beyond your local.
Thank you.
As a recently full-time student myself, I identify with the students out there in the audience. And so my advice is also my advice to myself, but it's to get involved and stay involved, and that your work in this, it truly, truly matters. Your studies in this and all that you're doing, we need more champions. It's plain and simple. We just need more champions.
Yeah, so I was a peer educator at 17. I brought condoms to my senior prom And it was life-changing. No, seriously, to be like the condom girl in my high school. I have an 8-year-old now who's in 3rd grade, and the thing she was most excited for in 3rd grade was that she could join student council. When applications came, she was like, I'm going to be president. And I was like, sweetie, you're 8. I think the 5th graders are going to, and she's like, I'm going to be president. She didn't get it. It's okay. She's learning to use her voice. She's also really encouraging others. She creates space. And you know what? The kids are all right. The kids are all right. Just keep using that voice.
I'll just echo that this is a pivotal moment for sexual and reproductive health and rights. That's true here in the US. That's true globally. And these issues are not just women's issues. They're issues that matter to all of us. They're core to some of the most fundamental and important choices we can make as human beings: who we love, how we grow or form a family, how we keep ourselves and our loved ones healthy and safe. And I will just emphasize that as we look ahead to 2024, that is the 30-year anniversary of the International Conference on Population and Development that was held in Cairo. It was the first time that the international community really came together to recognize collectively the importance of sexual and reproductive health and rights. And it is up to all of us to determine whether these next 30 years are going to be years where we're going forward or we're going backward. So at a moment of retrenchment on human rights, on women's rights in particular, it's going to take all of our collective resolve, and we all need to be involved.
Well, Rachel, thank you and everybody for your calls to action. And I think that's a pretty clear clarion call for us to end this panel. Thank you so much for joining us, and thank you to each of you for the work that you're doing and for lending your voices to this discussion today.
Thank you.
Thank you.